Good morning, everyone. So happy you're joining me and Chip today for Let's Chat. Let's get started on our first interview. October is Breast Cancer Awareness Month, and the Hamilton County Health Department is with me today to talk about the wonderful work they do for our community. Thank you so much for coming on, Jenny Lawson.
Thanks.
Good to see you.
Good to see you too. Thanks for having me.
You all do so much great work for the community. Talk to me about what you do and what you offer.
Okay, so personally, I am the Tennessee Breast and Cervical Screening Program Coordinator for Hamilton County, and also / Women's Health Navigator.
Wonderful. So talk to me about the services Hamilton County Health Department offers in regards to breast cancer.
Yes. So we have 5 different locations. In all locations we have healthcare providers that do annual women's health exams, and with that exam a woman can get a clinical breast exam. So that's baseline screening every single year by a healthcare professional. And then the nurse practitioner or healthcare provider will have a conversation with the patient and see what their risk factors are, do some education with them, and then if it's time for them to start imaging, they can send them to one of our providers in town to have mammograms, ultrasounds, whatever is appropriate for them.
Now, breast cancer is prevalent in our community across all demographics. You offer services that some people might think are only available to people with insurance or people with money. Mammograms are expensive. Who do you help?
So Tennessee Breast and Cervical Screening Program is a state program that can pay for women who don't have insurance, are low income, and live in Tennessee. They can pay for them to have all of their screenings, including their women's health exam. We'll pay for that too, which also includes a pap smear for cervical cancer screening. But we can pay for mammograms. If anything's abnormal, we'll pay for the woman to see a specialist. For diagnostic testing, we pay for everything up until diagnosis. And then if the woman is diagnosed with breast cancer, I can do a quick TennCare so they can seamlessly begin their treatment for breast cancer, because we know that early detection and early treatment leads to best case scenario.
Wonderful. I know there's a lot of mystery around what can cause breast cancer, but all the time they're discovering risk factors. Could you talk to me about what maybe individuals might be able to control?
Sure. There's the kind of 2 categories of risk factors. You have things that you can change and things that you can't change.
Okay.
Things you can't change are genetic history, or genetics, family history, even personal history. You can't really change that. But there are some things that you can change to reduce your risk of having breast cancer. Most of those are lifestyle changes. So you want to make sure that you have a good diet, good nutrition. You want to make sure that you're having regular exercise, that you're not smoking, you limit your alcohol, getting good sleep, reducing your stress. Those are all things that you can change to lower your risk for breast cancer.
And early treatment and screening is obviously very important, because if something is caught early, the treatment would be a lot less invasive, I'm sure. When should people begin screening or self-screening?
Right, so every woman should know, and men too, breast cancer happens to men also, but everyone should know what their normal is. They should look for changes, any skin changes, any nipple changes, any pain, anything abnormal. And then, so that's kind of baseline, is just knowing your own body.
Right.
And then you go every single year to your healthcare provider, where you get a clinical breast exam. So you get a breast exam by a healthcare professional. And then you speak with your doctor about your risk factors, and together decide when the best time for you to start your imaging would be, your mammograms, because a healthy, low-risk woman, it is recommended at age 40 that you start having a conversation with your doctor about imaging. But if you're high risk, you may need to start earlier than that.
Perfect. Thank you for sharing this very important information with October Awareness Month and all you do for the community, especially the underserved or low income, so they can, keep that check too. Thanks, Jenny.
Yeah, thank you for having me.
That was great. You can learn more at health.hamilton.org. We got all our information up there if you think you need to get checked. Everyone needs to get checked. You do not want to miss the rest of the show. Creative Arts Guild, River Run Health, and Chattanooga Comic Con, all that and more. This is the place for Let's Chat.